So many agencies say that they have quality care, but what does that really mean? Hi, my name is Howard Stein. I'm the owner of Home Helpers Home Care in Freehold, New Jersey. We service the greater Monmouth County area, and today we're going to talk about the 5 ways we can define quality care. The first thing that I want to talk about under quality of care is good communication. And this starts with really assessing the needs, understanding the needs, and what the care goals are. This is not only with that aging loved one, it could be with the spouse, or maybe it's with the entire family. Ideally, we want to ensure that good communication is always happening so that we can get that feedback to ensure that we're providing the best possible care. To understand the needs, be able to create a plan of care around those needs, continuously evaluate those, and then ultimately close that feedback with some minor changes is the earmark of good communication between an agency and a family. As a trusted resource, I encourage all my clients to call me for any problems that we can possibly help with. This could be either a question about something that they've observed or a challenge getting to a doctor's appointment. Whatever it may be, when we have that opportunity to talk together, we will come up with a solution that's going to work for you and your aging loved one. I would just add that, the good communication maybe would be with me, or it could perhaps be with the nurse, or even communication between the caregiver and the nurse. There are so many times that an observation occurs from the caregiver, and that communication occurs with the nurse to engage on a wellness conversation. And that could often manifest in a number of ways. Most often what we see is UTIs being identified because of a great observation from a caregiver and then good communication to the nurse, which of course turns back to a solution for the family. Number 2, training. And this is so important. Not only the basic training of becoming a certified home health aide, but also the ongoing training and specialty training, whether it's Alzheimer's and dementia, or mobility, or cooking for wellness. There are so many different topics of training that we could put into our caregivers so that they can address a variety of specialty needs that your aging loved one may have. The training always starts with that orientation to the case with a great care plan that's written by our nurse. Number 3, technology, how we document our care plans, notes, how we check in and check out of our clients. All of these technologies actually lend itself to better communication and to better outcomes because we have very easy access to the required information to provide the best level of care. Another element of technology is alerting devices and health hub technology that we have. Those are supplemental things that we can put into the home to ensure better coverage, more coverage, and be able to respond in the event of an emergency. Number 4, accreditation standards and best practices. Accreditation standards have really elevated the home care agencies. It's really critical that you have a competent nurse that's able to assess our clients properly and then be able to provide the proper follow-up with 30-day calls and 60-day visits. These accreditation standards are the foundational rules and operational guidance that we need to be able to provide the best level of service for our clients. And this leads to the best possible outcomes. Number 5, continuum of care and interdisciplinary team. These are my power partners. These are people that I work with every day. This is the reason why I'm involved with so many organizations and things like the Chamber of Commerce, so that I can meet a variety of providers and get to know the best of the best in our community. When someone's being discharged from a rehab, if I know that person at the rehab, that just makes that first handshake to in-home care that much easier. And then we want to follow through on that when that person comes home, maybe they need PT, OT in the home. We're going to be able to connect you with an amazing provider that I work with so that we can ensure that that care plan is followed through on completely. Podiatry is another one. Pain management could be another item. Elder attorney if needed. These are all things that we talk about in our initial assessment. And if those needs need to be addressed with a provider that client doesn't have, I want to be able to assist in the access to the best providers our community has. And we know that when we do that and we work together, we have amazing outcomes. For more information, visit our website at www.homehelpershomecare.com. Talk to you soon.